Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today, November 3rd, 2025, this video is on a JAMA Network Open article titled Light Exposure at Night and Cardiovascular Disease Incidence, published online on October 23rd, 2025. There's an accompanying invited commentary titled Illuminating the Risks of Nighttime Light for Cardiovascular Health. Light at night disrupts circadian rhythms linked to cardiovascular function. Circadian rhythms influence blood pressure, autonomic tone, inflammation, and metabolism. This was a prospective cohort of 88,905 UK biobank participants, mean age around 62 years, 56.9% were women. Wrist-worn light sensors were tracked for about a week and a 9.5-year follow-up period. The outcomes: coronary artery disease, myocardial infarction, heart failure, atrial fibrillation, and stroke. Cox proportional hazards models were used. They were adjusted for demographics, socioeconomic status, lifestyle, sleep, and polygenic risk. What do they find? When you compare the brightest versus the darkest nights, increased risk of coronary artery disease, hazard ratio 1.32, increased risk of myocardial infarction, hazard ratio 1.47, increased risk of heart failure, hazard ratio 1.56, increased risk of atrial fibrillation, hazard ratio 1.32, increased risk of stroke, hazard ratio 1.28. Limitation of the study: observational, possibly unmeasured confounding. Key takeaways: nighttime light is an independent cardiovascular disease risk factor. Reducing light at night may complement prevention strategies. The accompanying commentary talks about night light and heart risk. Artificial night light is rising globally and is associated with cardiometabolic harm. The UK biobank study uniquely used individual sensor-based exposure. Night light increased risk of coronary artery disease, myocardial infarction, heart failure, AFib, stroke, independent of sleep and activity. Mechanistic insights: artificial light at night disrupts circadian rhythm, suppresses melatonin, elevates sympathetic tone, alters glucose metabolism, increases inflammation, and worsens insulin sensitivity. Limitations of the study: need spectral analysis, blue versus warm light as a future direction, and mechanistic trials. The study didn't examine sleep timing and social jet lag. Key takeaway: reduced nocturnal light exposure as a pragmatic cardiovascular disease prevention tool. Clinical pearls: circadian health is increasingly recognized as a cardiovascular determinant. Recommend minimizing nocturnal light exposure for high-risk patients. Counsel on sleep hygiene: blackout curtains, avoiding screens, that is TV screens, computer screens, mobile screens, before you go to bed. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.